Kallmann Syndrome, an investigation of the olfactory sulci. Marisa Clement MD MSc 1, Angela Delaney MD 2, and John Buttman MD 2. George Washington University Hospital 1, Washington, D.C. National Institute of Health 2, Washington, D.C. Purpose: Kallmann syndrome is a rare genetic disorder characterized by hypogonadotropic hypogonadism and hyposmia, 1,2. Currently, the diagnosis of Kallmann syndrome is reliant on MRI to establish the morphology of the olfactory bulbs, 1,3,4. When high-resolution imaging of the skull base is unavailable, the presence of the olfactory sulcus has been used as an indirect marker of normal olfactory bulb development. We examined whether the olfactory sulcus is indeed a reliable marker for the development of the olfactory bulb. Background: Kallmann syndrome is a sporadic and inherited chromosomal disorder, resulting in olfactogenital dysplasia affecting 1:10,000 males and 1:50,000 females, 1,4. Failed neuronal migration from olfactory placode to the hypothalamus, 1,4. Embryonic olfactory epithelium gives rise to cells that differentiate into GnRH secreting neurons. Abnormal migration of olfactory neurons and gonadotropin releasing hormone producing neurons. Failed migration causes rhinencephalon hypoplasia/aplasia as well as GnRH deficiency. Genetics: variable, sporadic, majority, as well as X-linked, autosomal recessive and autosomal dominant, 3,5. Cal1 gene was the first mutated gene identified on the X chromosome in many inherited forms. Cal1 gene encodes for nosmin-1, a protein with neuronal cell adhesion properties, involved in neuronal migration, and outgrowth of axons 3. Speculated failure of nosmin-1 to direct olfactory nerves and GnRH producing neurons during development. Mutations in other genes identified involved in neuronal migration: fibroblast growth receptor 1, FGFR1, prokineticin 2, PROC2, and prokineticin receptor 2, PROC2R3. Olfaction: olfactory receptor neurons are located in the nasal mucosa epithelium. Axon bundles travel through the cribriform plate to the olfactory bulb. Olfactory bulb is the ganglion of the olfactory nerve and collects sensory afferents. Olfactory tract connects the bulb with the perforate substance and olfactory cortex, 2,6. Olfactory sulci development. No studies to date exist on the embryologic development of the human olfactory sulcus. Hypothesize that formation of the olfactory sulcus depends on the presence of an olfactory tract. Neuronal migration is thought to originate from the olfactory placode, which would in turn affect the development of olfactory tracts and olfactory sulci. Hyposmia and anosmia. Pennsylvania Smell Inventory Test quantifies ability to detect odors by a threshold level. Consists of 4 booklets with a scratch and sniff strip embedded with odor on each page. The odor is scratched with a pencil, then the patient selects the odor from 4 multiple choices. Total 40 questions. Score is compared to normative age and gender matched base. Olfactory function is graded mild, moderate, severe hyposomia or anosmia. Self-reported subjective hyposmia/anosmia. Clinical evaluation. Materials and methods. 17 males with Kallmann syndrome, 15 to 67, mean age equals 26, and 19 healthy volunteers were enrolled and consented under an IRB-approved protocol including MRI at 3.0T, Philips Achieva, SR 3.3.3. Coronal star images were oriented perpendicular to the anterior skull base and extended from the sella through the nasion, 3.0 mm slice thickness, 0.35 mm resolution. The olfactory bulbs and sulci were characterized as either normal, hypoplastic or absent. Hypoplastic sulci were further classified by 1. Superior inferior and 2. Anterior posterior continuity. MRI findings in patients with hypogonadism and hypoanosmia. Results. Patient. Right olfactory bulb. Left olfactory bulb. Right olfactory sulcus. Olfactory sulcus. Age. 1. H. A. N. 18. 2. 17. 3. 21. 4. H. SI. H. DAI. 39. 5. H. DAP. 19. 6. 24. 7. 30. 8. 15. 9. 31. 10. 16. 11. 12. 52. 13. 67. 14. HSI. 20. 36. MRI findings in patients with hypogonadism and hypoanosmia. N equals normal. A equals absent. H, SI equals hypoplastic superior inferiorly. H, DAP equals hypoplastic, discontinuous anterior posteriorly. Normal 3.0 T-star coronal 3.0 mm slice thickness, 0.35 mm resolution. Healthy volunteer. Straight gyrus. Medial orbital gyrus. Olfactory sulci. Olfactory bulbs. Normal, coronal anterior to posterior imaging. Results. Morphologically normal olfactory sulci were present in 35%, patients with absent or hyperplastic olfactory bulbs. Emissary veins are visualized in the expected location of the olfactory bulbs within the olfactory grooves of the anterior cranial fossa. Normal sulci, absent bulbs. Demonstrated in 35% of patients with Kallmann syndrome. Hypoplastic sulci, absent bulbs. 53% of patients with Kallmann syndrome had absent bilateral bulbs and hyperplastic sulci. In this example, the sulci are discontinuous anterior to posterior, rudimentary sulci present posteriorly. Results. The left olfactory bulb was absent in 16 patients and hypoplastic in 1 patient. The left olfactory bulb was abnormal in all enrolled patients with Kallmann syndrome. The right olfactory bulb was absent in 13 patients and hypoplastic in 3 patients. Results. The left olfactory sulcus was hypoplastic in 11 patients, but never entirely absent. The right olfactory sulcus was hypoplastic in 7 patients and only absent in 1 patient. Conclusion. In our population, normal bulbs were nearly always associated with a normal sulcus. However, the converse was not true. Normal olfactory sulci were present in 35% of subjects with absent or hypoplastic bulbs. Therefore, direct imaging of the bulbs is required to exclude Kallmann syndrome. Reliance on the olfactory sulci as an indirect marker of bulb development is not adequate. Conclusion. Our findings also demonstrate that the left olfactory bulb and the left olfactory sulcus were more affected than the right in patients with Kallmann syndrome. There is growing evidence that in humans lateral differences exist in processing olfactory information. 7, where the right hemisphere is more involved in processing olfactory stimuli.